All right, so now we're going to talk about the nursing process and how we put all the pieces together to come up with our care plan. Our care plan is actually the plan that we are going to follow in order to provide adequate care for the patient, which enables them to be able to get out of the hospital, maintain their quality of life, or just overall feel better. So the nursing process, the first thing that we always do is we assess. We complete an assessment with the patient. Then what we do is we come up with a nursing diagnosis. From our nursing diagnosis, we come up with a plan which has goals and outcomes. And then we have an implementation, which is putting our plan into action. And then we evaluate our plan and our implementation. So it's assessment, nursing diagnosis, plan, implementation, and evaluation. Throughout your nursing program, we'll talk about the nursing process and we'll call it API, Assessment, Planning, Intervention, and Evaluation. When we do that, we know that nursing diagnoses are created during the planning. So if you hear API, don't think that, oh, that doesn't mean we have to drop the nursing diagnosis. You still need the nursing diagnosis. All right. On the next slide, this is our patient we're going to talk about, and this is Mr. Anderson. He's a 72-year-old man who lost his wife 2 years ago, lives with his daughter and her family. He fell on the sidewalk, and he's been complaining of right hip pain and leg pain, a 10 out of 10, as well as shoulder pain on the right side, a 9 out of 10. He was taken to the emergency room and admitted for a broken hip. Surgery was done to repair the hip, and he is now the 3rd day post-op, and you're going to be taking care of him. He's on bed rest and unable to turn to the right side. He's anxious, alert, and oriented ×3, but slightly confused. He has a history of diabetes, hypertension, and does not want to move because of the pain. Every time he's repositioned, he moans and groans. Assessment reveals that he is beginning to have a pressure sore on his left heel and sacral area, and he has an indwelling catheter in place. So that is our assessment. Part of it may have been attained from report. Most of it was probably in conversation with the patient, especially the pain scale. So now we're going to look at clustering the information. And when you use a sheet like this, which you're going to have access to, you can put that information into these boxes. So you have safety, sociocultural, intellectual, emotional, and so on. What you're going to do is you're going to recognize the data and you're going to put them in the appropriate boxes. Then you're going to look at, is there a pattern here? Then you're going to look at, are there any problems that we need to focus on, and what are the strengths? And then you come up with your plan. So we begin the assessment, and in the assessment we found all that information that I previously stated. Here's the clustering data form again. So, safety, the patient fell. We know developmentally this patient is an older adult. He's 72. Cardiovascular, he has a history of hypertension. We may also put here about the diabetes, since diabetes does affect your cardiac system. Oh, his skin, yes, he has bruises, cuts, and incision, and I believe they said he was starting with a pressure sore. Musculoskeletal, he injured his right shoulder, hip, and leg, and he's difficult to move, and he's on bed rest. You don't really know what his level of understanding is. We need to go back in and evaluate that. We definitely know he's anxious, and the family's anxious. But we do know that he's alert and oriented ×3. He's confused about what caused the fall. He doesn't know exactly what happened. So we may have to work on that. His pain's a 9 out of 10 and a 10 out of 10. He has a Foley catheter in place. That'll definitely put him at risk. So now we have to come up with our nursing diagnosis. And there's quite a few that we could come up with, but right now we're going to just focus on one. Impaired skin integrity related to an altered mobility as evidenced by, that's what AEB is, moaning when attempting to turn patient. You could also put here, if you actually saw the pressure sore, okay, what the size of it is, location, all right, you would put that here also. This may not be the #1 nursing diagnosis, but this is the one we're going to discuss now. And this nursing diagnosis you would find in your Dungeness book, which hopefully you have. Let's see what page it is on. All right, so on page 950 in your Dungeness book, the nurse's pocket guide, where it has all the nursing diagnoses, on page 950 is where you can see a good description of this. Well, of the skin one. This one here is the impaired mobility related to falling, as evidenced by inability to easily move extremities, grimacing when trying to change position, and reporting a pain level of 8 out of 10. Let's go back to the previous slide real quick. So on the impaired tissue integrity, like I was saying, that is on page 950 in your Dungeness book. That is the one that you may focus on, but you may not. You will be writing all potential nursing diagnoses, as you will see in the next screencast-o-matic that I've created. How do you prioritize? So the next one we're going to look at is the impaired mobility related to, that's RT, a fall, AEB, as evidenced by inability to easily move extremities, grimacing when trying to change position, and reporting a pain level of 8 out of 10. It was actually 8 out of 10 and 10 out of 10. You could specify where exactly that was. So we have our nursing diagnosis. We need to have our goal, which is patient will move all extremities without pain. Now, you want to try and have a overarching goal, but your outcome is going to be more specific, as you'll see below, where it says patient will report pain level of 4 out of 10 while demonstrating ability to move all extremities within 72 hours. So you will see that it's specific. You know, we have within 72 hours and we have a pain level. It's measurable. Again, we have a pain level and the time. It's definitely time focused. So this would be a SMART outcome. Specific, measurable. Includes an assessment, and then it is very time focused. So a lot of students will say, how do you get the 4 out of 10? Well, that is actually in discussion and assessment with the patient to find out what is their pain goal. So that would be the outcome. Again, there's our goal. Patient will move all extremities without pain. And then our patient will report a pain level of 4 out of 10 while demonstrating ability to move all extremities within 72 hours. This is very important, our planning stage with the goals and the outcomes. This is for the skin integrity one, where patient shows no signs of skin breakdown. And the outcome would be that the patient's sacral area will show signs of healing, which are decreased redness, absence of skin eruption, cool to touch by the morning shift. You could also put here within 24 hours. You could put in here within 48 hours. So, what are some of the interventions that we're going to take? The first thing that we're going to do is we're going to initiate fall precautions. and there is a variety of safety measures that can be taken. Each facility is a little bit different. You need to know the specifics about your facility, but one of your interventions could just be initiate fall precautions for patient during hospital stay. The next one could be give patient no-slip socks. Okay, this is a big thing. You know, the patients come in and, you know, if their family wants to make them comfortable, they bring them their favorite slippers and they may not have the proper bottoms. These socks actually do. They have the proper bottoms where it has a little bit more of a grip so they don't slip and fall when they get up to walk. The next would be to assist patient to ambulate at all times, or to have a wheelchair available for patient while walking. But definitely assist patient to walk. And when you write something like that, you will also want to write how far. You know, patient will walk 6 feet to bathroom. Assist patient to ambulate. Again, assisting patient to ambulate. Here you see them using a walker. Right here is a walker. Okay, assist patient to ambulate with walker. Another thing that would be important is about the pain medication. If the patient is having pain, one of your interventions would be to pre-medicate patient with pain medication before getting up to ambulate. Right? Now we're going to be talking about the skin, because we're doing both of these diagnoses. The first one I just talked about were the interventions for the fall. This is interventions for the skin. So you're going to inspect the skin, noting all the red areas. You're going to turn the patient every 2 hours. You're going to use a draw sheet to assist in position change. Use protective positioning, meaning putting the pillows in the appropriate spots to get the pressure off of the bony prominences. And that's the avoid pressure on bony prominences. Apply heel protectors, and then consider consult with a wound care specialist. When we evaluate, we're going to evaluate Mr. Anderson has been consistently turned every 2 hours. Healthy granulation tissue is noted in the wound bed. This would be for the skin integrity one. So that is the end of the slide presentation, in which we have discussed Mr. Anderson here, and he is probably one of the typical patients that you would see in the hospital using our nursing process. And next you will see how the concept map works.